Hello, my name is Dawn Lang-Shear, and I'm the Chief Development Officer for the Upledger Institute International and the Beral Institute. For over 35 years, we've been working and training healthcare professionals like yourself in our advanced modalities, specifically craniosacral therapy, somatoemotional release, visceral manipulation, nerve manipulation, and many more. The beauty of our profession is that we get to be lifelong students of the body, finding new ways to help our patients to live healthier, happier lives. So today I'd like to introduce to you some of my colleagues, and they're going to share some words of wisdom about the benefits of manual therapies, and specifically those that are taught through Upledger and Beral Institutes. So first, I'd like to introduce you to Fred Stallman. Fred is a physical therapist. He's also one of our international instructors with the Upledger Institute, as well as a clinical therapist here at the Upledger Clinic in Florida. Fred's going to talk about how when he incorporated craniosacral therapy into his physical therapy practice, it really enhanced his ability to work with his patients and to achieve greater outcomes for their health.
Hi, my name is Fred Stallman. I'm a physical therapist and a certified craniosacral therapist through the Upledger Institute. Craniosacral therapy is probably the most profound treatment approach that I've ever encountered. Craniosacral therapy has given me the tools to guide and direct my clients to finding the primary lesion site and then giving them the tools to handle it. Before getting into craniosacral therapy, I was an actively practicing manual physical therapist, and I was very good at what I was doing. However, I always felt like I was treating symptoms. I could never help the client get to the source. But with craniosacral therapy, what I consider an inside-out treatment approach, I now have the tools and everything I need to guide my clients to a place of health and vitality and facilitate healing or improve their function within their dysfunction if that's what's necessary. Craniosacral therapy to me is an amazing discipline and a technique and a philosophy of treatment that is applicable to almost any healthcare professional. Whether you're a physician, a DO, a physical therapist, an occupational therapist, a massage therapist, or other type of body worker or healthcare practitioner, this work is easily adaptable to your practice setting. As far as practice settings go, I personally have been able to apply these techniques that we learn in craniosacral therapy in hospital settings, in private offices, in nursing homes, in home care settings. So it's extremely flexible, it's very adaptable, it's a standalone treatment or an adjunctive, and anyone can use it. If you're giving some thought to taking a craniosacral therapy class, I would highly recommend you do so. It certainly has the potential to enhance your palpation skills, your treatment awareness, and bring out a better outcome for your clients.
Thank you, Fred, for those words of wisdom. Now I'd like to introduce you to Jean-Pierre Beral. Jean-Pierre is the developer of visceral manipulation, nerve manipulation, new manual-articular approach, and other disciplines. He is an osteopath and a physical therapist and resides in France. Jean-Pierre is going to work with you and talk to you about the importance of not being a specialist, the importance of really looking at the person as a whole, so that when you're working to analyze the body, that you're actually going to get to the source of their dysfunction, the actual cause, as opposed to just treating symptoms. And you're not going to specialize in just a certain area, such as the shoulder or the foot. You're actually going to be looking at the entire body to determine what could be causing that shoulder pain. So Jean-Pierre is going to share some insights with you about the work that he's developed through visceral, neural, and new manual-articular approach.
For our profession, even if the symptoms should not be neglected, it's only a part of the diagnosis. Finally, it's more when you do a lot of interrogation, it's more the diagnosis of the patient. It's not your diagnosis, because the patient will speak about what he feels, but it's not the cause. If we take the only example of the right shoulder that everybody knows, connected very often with liver, connected with the hormonal system, female hormonal system, if you speak only the shoulder and you miss what is in connection with the hormonal system, which is very connected with the liver, you will treat the ligamentous system, the muscular system of the shoulder, but you will miss the cause. And it's why for us it's so important not to focus so much on the cause, on the symptoms, sorry, but on the cause. We are not specialized. An organism is something which is very important everywhere. To be good in the brain is good, but to be good in the foot is good, in the organ is good. So you must never neglect one part of the body. And it's so important because when you are specialized, it's like you have a little sea of the body, and you cannot have very good results for the patient. For instance, when I speak about the brain, what is a brain without a body? What is a body without a brain? So if you work on the brain, you must work on the body. The only example I can give you, we spoke about the liver. If you work on the liver, you have a big effect on the blood, venous, and lymph circulation of the brain, which is a lymphatic system. We'll see a little later.
Thank you, Jean-Pierre, for those wonderful insights. Last, I'd like to introduce you to Kelly Handyside. Kelly is one of our international instructors with the Beral Institute, and she's going to talk about how she integrates various disciplines into her manual therapy practice.
I am a certified craniosacral therapist. I am also a certified visceral manipulation practitioner. I integrate craniosacral therapy and visceral manipulation in my private practice. And I also use not only core curriculum techniques, but I also use advanced level classes. So even addressing the brain, the nerves directly, the vascular system, even joints. But I'm always integrating what the body needs when a patient comes in to visit. Jean-Pierre, the developer of visceral manipulation, he says, it's important that we don't specialize in one discipline, that we don't become specialists in just one thing, that we kind of keep our minds and our hands and our learnings open to possibilities, because we want to be open to possibilities when we treat our patients. So the question is how do I utilize multiple disciplines in my practice? So when a patient comes in, when I use evaluation, I'm going to use like visceral manipulation. I'm going to use general local listen, manual thermal diagnosis. Even with craniosacral therapy, I'm going to evaluate the craniosacral rhythm using square, the symmetry, the quality, the amplitude, the rate. And I combine all of these evaluation tools so that I can really triangulate what is it that the patient needs at this moment in time when they come in. And after that, I'm able to then come up with a treatment plan. You know, am I working with an organ? Am I working with the viscera, the dura, the membrane system, the nerves, the joints, etc. So we evaluate for what the body needs at that point in time. I find that because my hands have a knowledge all across disciplines and various disciplines, that I'm much more flexible as a therapist in treatment. Our knowledge and awareness and our hands go where the patient's body takes us. So we are able to be amiable, flexible for their needs. I think about somebody who came in and, you know, it's just, if my evaluation went to their upper left quadrant, let's say, and like just below their ribs, and I find that this is an area of tension and restriction, and then I get more specific that it's a stomach issue, but then I ask the patient, why are they in to see me? And they're saying that they're experiencing migraines, and I go to evaluate more, and I'm feeling that their cranial vault is restricted, and maybe it's their left tentorium and sphenobasilar joint. We have an organ issue that leads maybe into the esophagus, into connective tissue that then pushes up into pressure in the cranial vault that would then restrict the sphenobasilar joint. And maybe the membranous system, like the tentorium, is going this compensatory motion. So I am now blending visceral manipulation and craniosacral therapy all in one session. So in a nutshell, our job as manual therapists is to keep learning, to keep integrating our hands and helping the patient integrate their own bodies. I encourage you to get out of your comfort zone, go take a class and learn more. Thank you.
Thank you, Kelly, for your words of wisdom. And thank you for being here with me today. It's a pleasure to be able to share and be on this journey together to make the world a healthier and happier place through our manual therapies. We look forward to seeing you at one of our programs in the future and hearing about the successes that you're having with your clients through our manual therapies. Have a wonderful day.